everyone. I'm Carrie Thibodeau, the National Director of Programs and Public Policy at the Kidney Foundation of Canada. Welcome to today's webinar, Rare Kidney Diseases, Challenges, Opportunities, and Alport Patient and Family Perspectives in collaboration with the Alport Syndrome Foundation. Before we get started, we'd like to go over just a few items so that you know how to participate in today's event. We're offering this webinar in French and in English using simultaneous interpretation. During the session, speakers will present in English. To hear the presentation in French, click the interpretation icon in the Zoom toolbar and choose French as your language preference.
Nous vous proposons ce webinaire dans les deux langues en utilisant la traduction simultanée. Pendant la présentation, les intervenants s'exprimeront en anglais. Pour entendre la présentation en français, choisissez français dans l'icône d'interprétation de la barre d'outils Zoom.
You've joined the presentation listening with your computer's speaker system by default. All participants who enter the webinar will enter with their audio muted. If you'd prefer to join over the telephone, select the arrow next to the mute unmute button icon on the bottom of your screen in the Zoom toolbar. Select switch to phone audio and then select phone call and follow the prompt to dial in. Today's webinar is being recorded. For those of you who are joining on a computer, you'll have the opportunity to submit text questions to the presenters by typing them into the Q&A pane found in the Zoom toolbar at the bottom of the meeting window. Please avoid using the chat box to submit your questions. It helps us to monitor them more effectively when they're submitted in the question pane. You can send your questions in either French or in English at any time during the presentation. We'll collect them and address them during the Q&A session at the end of the presentation. To protect your privacy when you ask a question, please do not use your name or provide any other personal identifying information. Before we begin our webinar today, it's important to recognize the Indigenous land that we're on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honoring the original occupants of a place. They also help Canadians to recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. I acknowledge with gratitude and respect that I'm joining this meeting today from Newmarket, which is the traditional territory of the Haudenosaunee, the Wendat, and the Anishinaabe peoples. If you know the territory from which you're joining today, please feel free to share it in the chat. The Kidney Foundation of Canada would like to thank Otsuka, our sponsor for the 2024 webinar series. Their ongoing support allows us to come together to have broader, bolder, and braver conversations. The information shared in today's webinar is current as of today, February 21st, 2024. The information shared in this webinar is not intended as medical advice. It's general in nature and it doesn't necessarily cover all circumstances. While we do make every effort to be accurate, we recommend that you seek professional advice for your individual situation. So to start the conversation today, I'd like to introduce our first panelist, Dr. Mumita Barua. Dr. Barua is a clinician, scientist, and nephrologist at Toronto General Hospital. Her clinical and research program focuses on understanding why people develop chronic kidney disease through exploration of genetic susceptibilities in patients, population-based cohorts, and experimental models. She has a particular interest in disorders of the kidney filter known as glomerular diseases. Unfortunately, she wasn't able to join us live today, but in this pre-recorded session, Dr. Barua will speak about rare kidney disease using Alport syndrome as an example.
Okay, well, thank you for that kind introduction, and thank you to the Kidney Foundation of Canada for the opportunity to present in today's webinar. So the title of my talk is Alport Syndrome, Rare but More Common Than We Thought. And here are my disclosures, which include my affiliations, my research funding, my advisory and leadership roles, as well as speaking opportunities. So rare disease collectively is actually quite common. And there are many different rare disorders in chronic kidney disease. Rare disease is often misdiagnosed, and I'll speak about Alport syndrome and why that is. And many of the lessons we learn from Alport syndrome can be applied to rare disease. So Alport syndrome is a genetic or hereditary disorder that we are realizing more and more has a wide clinical breadth. And there are the classic forms of Alport syndrome that manifest with kidney disease associated with hearing and eye abnormalities. And these individuals who present like this are most likely to be diagnosed properly. But then there are individuals that present mildly with the disorder or atypically or in a moderate fashion with the disorder. And individuals with mild disease might have blood in the urine that is not accompanied by a protein in the urine called albuminuria, or it may be accompanied by a low amount of albuminuria, and these individuals may never progress or experience kidney failure in their lifetime. Then there are the atypical forms of Alport syndrome. An example would be adults that present with this histopathologic lesion known as focal segmental glomerulosclerosis, which is really just a fancy way of saying scarring of the filter in the kidney known as the glomerulus. And it is these types of individuals or these forms of Alport syndrome, the mild forms, the atypical forms, that are more likely to not get the correct diagnosis. And so that would apply to rare disease in general. There is overlapping clinical features that might not be that distinguishing, or there might be a wide clinical breadth that make it more difficult to achieve the correct diagnosis in all cases. Alport syndrome is a genetic or hereditary disorder, and it is due to genetic defects in any of the collagen 4A3, 4A4, and 4A5 genes. So I tell patients in clinic that collagen is the most abundant protein in the body, and every organ has collagen. But there are many different types of collagen, and type 4 collagen in particular is a critical component of this membrane in the kidney filter known as the glomerular basement membrane. And if you have genetic defects in any of the collagen 4A3, 4A4, or 4A5 genes, that leads to Alport syndrome. So I mentioned that rare disease collectively is actually quite common, and there are many different rare disorders in chronic kidney disease. Estimating the prevalence of rare diseases is challenging, and that is in large part to ascertainment bias. As I said, the more classic forms are the ones that will be more likely to be diagnosed with the correct diagnosis, but it's these atypical and milder forms or ones with overlapping clinical features with other disorders that might not be brought or given the correct diagnosis. But it has been the emergence of these genetically characterized population-based cohorts that have started to shed insight into the prevalence of both common and rare disorders. And studies, including our own contributions, suggest that Alport syndrome prevalence conservatively is at least 16-fold higher than previous estimates. And achieving a diagnosis is important because while there is no FDA-approved treatment for Alport syndrome, as is the case for many rare disorders, it nonetheless, getting the correct diagnosis unlocks a few other possibilities, as written about by Lisa Bonbrack, who's the executive director of the Alport Syndrome Foundation, in this piece that she wrote that appeared in Glomerular Diseases in 2023. And she writes about her own experience and her family's experience with getting the correct diagnosis, and how when that was obtained, that started to allow them to understand recommended treatment options, identify family members that may be at risk. It brought awareness of potential complications to be monitored, such as hearing loss and eye abnormalities in Alport syndrome, and these associated symptoms might not be so obvious in mild and moderate forms. It importantly potentially raises opportunities to participate in research and clinical trials, which I'll speak about on a subsequent slide. And it also provides options to connect with other patients and families with the same diagnosis. So what influences this broad clinical spectrum in Alport syndrome and in other disorders? Well, genetics is a large part of that. So this is a figure taken from a review paper that we published in 2022. And in panel A, what we're showing here is that the type of genetic defect is influential on the clinical spectrum or the phenotype. So gene encodes for protein. In the case of Alport syndrome, gene is coding for collagen. There are substantial genetic defects called deletions and nonsense that lead to deletions in the encoded protein, and these tend to lead to severe disease. By contrast, there are more milder types of genetic defects called missense variants, which leads to substitutions in these single amino acid building blocks of the encoded proteins. And I use this analogy to patients that it's like a typo, that you have a sentence, but there's a typo within it. And even though the sentence is still understood, it's not correct. And this type of genetic defect leads to a more milder phenotype. Another influential factor is the number of genetic defects an individual has. So the collagen 4A3 and 4A4 genes are on an autosome, meaning that males and females both have 2 copies of these genes. So individuals who have a single genetic defect would tend to have more milder disease than those individuals with 2 copies of a genetic defect, what we know as autosomal recessive disease. For collagen 4A5, which is on the X chromosome, males have 1 copy of this gene. So males tend to have more severe disease than females who have 2 copies of collagen 4A5, and the other collagen 4A5 can compensate. We also see that a similar trend when we look at the UK Biobank, which is a cohort of 500,000 adults who have been genetically characterized, and their clinical information is also available. And what we see is that individuals with 1 copy of a genetic defect in collagen tend to have more milder disease than individuals with 2 copies of a genetic defect. Now, I will say that these are generalizations, and there are many exceptions to this rule. So this part about genetic defect and how it influences the clinical phenotype is not just academic, but actually has real implications for therapeutic development. And a great example of that is in cystic fibrosis, where there are now different therapeutic agents that have been developed based on the underlying genetic defect, which leads to different mechanisms by which lung failure occurs in CF. So for Alport syndrome, when you have this substantial genetic defect where the encoded collagen protein is not made, this leads to upregulation of collagen receptors, which leads to an inflammatory response and ultimately scar formation and chronic kidney disease. By contrast, these more milder genetic defects known as missense variants do lead to production of collagen protein, but these collagen proteins are abnormal and misfold, leading to cell stress, which eventually the cell doesn't like and will die, leading to chronic kidney disease. Again, this is a generalization. There are some nuances to this explanation, but for the purposes of keeping it simple, I'll leave it at that. And indeed, it is a very exciting time for Alport syndrome and other rare glomerular disorders, or disorders where there is disease of the filter of the kidney known as the glomerulus. And this is a table that we published in May 2023 in a review paper that lists 5 agents currently in clinical trial enrolling individuals with Alport syndrome as well as other rare glomerular diseases. So the first agent that is listed is called ELX2, which is known as a read-through therapy. And this agent is specifically targeting those severe genetic defects in individuals with Alport syndrome. And the reason it's called a read-through therapy is because it forces the cell to read through the genetic defect and make full-length collagen protein. And this agent is applicable to other genetic disorders that are caused by severe genetic defects like nonsense variants. The other 4 agents are not targeting the underlying genetic defect, but rather are targeting a more distal pathway that are common to other glomerular disorders, including IgA nephropathy, FSGS, diabetic kidney disease, and minimal change disease. Not listed on this slide are 2 additional clinical trials that do not yet have clinical trials numbers, but information can be found about these studies on the Alport Syndrome Foundation website that I will show in one of my last slides. So why are pharmaceutical companies now interested in Alport syndrome and rare glomerular diseases? Because I just said that there is that it is an exciting time for Alport syndrome and rare glomerular disorders, and that is because there is a relative resurgence in clinical trials. So one of the reasons is because of more widespread use of genetic testing that has uncovered more Alport syndrome cases. And one of the challenges in rare disease is actually recruiting a sufficient number of patients to examine whether or not a therapeutic agent is effective. And so it is useful to be able to add additional patient populations to facilitate meeting recruitment requirements. And finally, alongside advances in gene sequencing technology has been advances in genetic technologies that could be leveraged for therapy. So examples of this would be mRNA, as well as CRISPR-Cas9 gene editing. And so pharmaceutical companies are keen to apply these to genetic disorders. And pharmaceutical companies in general, or some of the pharmaceutical companies, are very interested in understanding the genetic basis of common and rare diseases, including AstraZeneca and Regeneron. AstraZeneca has sequenced 2 million genomes. And the reason for this is because if it can understand the genetics underlying both rare and common diseases, this identifies therapeutic targets. Similarly, the federal government is also interested in rare disease. And last year, there was the first ever national strategy for drugs for rare diseases that was announced with a total investment of up to $1.5 billion. As Lisa described in her patient perspective piece, having resources for Alport syndrome and for other disorders is important. And so the Alport Syndrome Foundation is a fantastic fantastic resource for both patients and physicians. It gives a tremendous amount of information, including information on clinical trials. Similarly, the Alport UK is a wonderful website that patients and physicians can use to obtain information. So this is my final slide. I'd like to thank you for your attention. This is a picture that the Alport Syndrome Foundation gave me, so I thank them for that. It is a picture of the attendees at the Alport Connect 2023 in San Diego this year, which brings together patients across North America and around the world. Thank you for your attention. And I wish I could be there in person or live to answer your questions, and I hope that there will be future opportunities where I can be.
We'd like to thank Dr. Barwa for her very informative presentation. If there are any questions, please enter them into the chat, and if she's able to join us at the end of the webinar, she'll address them at that time. I'd now like to introduce you to our moderator today, Lisa Bonebrake. Lisa is an Alport syndrome patient caregiver, advocate, and executive director of the Alport Syndrome Foundation, a patient support organization with more than 9,000 members, led by and dedicated to individuals living with this rare kidney disease. 10 years ago, her youngest son was diagnosed with Alport syndrome, which led to the understanding of her own misdiagnosis stretching back more than 4 decades. In 2021, her then 19-year-old son experienced end-stage kidney disease and dialysis and was given the gift of life through kidney transplant by his then 21-year-old brother. Lisa has published articles from patient and caregiver perspectives in the Journal of Glomerular Diseases and in the Clinical Journal of the American Society of Nephrology. She speaks with patients from across the globe every day whose kidney disease journey is similar to her own. Over to you, Lisa.
Thank you so much. Thank you, Carrie. And on behalf of the Alport Syndrome Foundation, I want to thank you and your colleagues for this opportunity to raise awareness about rare kidney diseases, and particularly to speak with several patients, who are experiencing this every day and living from their perspective and sharing their insights. So thank you so much. I really appreciate this opportunity. And I was really honored that Dr. Brew actually referenced an article that I wrote that was really pretty thrilling to me. But it shows that there are wonderful, dedicated doctors out there who are really listening to patients, and that's extraordinarily important in the work that we do at Kidney Foundation of Canada and at Alport Syndrome Foundation. I want to introduce you to begin with our panelists that are going to speak today, who are living with Alport syndrome. That's the most important thing to hear from patients at this point. Liz Peterson and her son Lucas. Liz is a 53-year-old married mother of 3 children with Alport syndrome. She's a former elementary school teacher turned small business owner with a very busy family life. She and her husband Kurt are from the Calgary area, met in college where they both were on the men's and women's basketball teams, and that love of sports continues to play a huge role in their family. They're now parents to 3 very active adult children. And Liz, who has Alport syndrome herself but no symptoms to date, supports our kids through their daily lives as they navigate the appointments and other aspects of managing their disease. Her daughter Olivia and sons Lucas and Leighton have not been defined by Alport syndrome at all. They're excellent students, athletes, and social butterflies, but they know others who have been less fortunate in the way the disease has affected their own young lives. Liz's family, including Kurt's, her husband Kurt's father, Harold, and mother Merla, have been really involved with many fundraising efforts over the past 15 years. They've funded a variety of research projects in the hopes of helping to find treatments, novel treatments, and ultimately a cure for Alport syndrome. They remain hopeful for a brighter future for all those affected. So I'm going to turn things over to questions for Liz at this point. Liz, thank you so much for joining us today. We really appreciate it, your willingness to share your experiences. Can you tell me a bit about when you and your children were diagnosed with Alport syndrome and what led to the diagnosis? Because diagnosis can be quite a journey in a rare kidney disease.
Right. Thank you. Thanks so much, Lisa. And just in general, thank you, Lisa, so much for everything you do for ASF and Alport's patients. So it was quite a specific scenario. Lucas got sick back 17 years ago when he was 6 years old. And I just noticed that he had, little boys, when they go to the bathroom, sometimes they don't get it right in the toilet. So it was on the seat of the toilet, pardon for the graphics, but it's important. We saw that it was dark, and it just was really alarming, and he was a little bit unwell. So we took him into an emergency, actually in a small town emergency. And the point in telling this piece is that we had a really astute emergency doctor who was just really, pretty aware that this needed to be, you need to follow this up. So we followed up right away with the Children's Hospital here in Calgary, which is just an excellent facility, of course. And we saw a great pediatric nephrologist, and she originally diagnosed him with glomerular nephritis, and that was just sort of the first thought. And then right away, she had us seek out a hearing test, like right away, which, back 17 years ago, like I just, I know a little bit about your story, a little bit about other people who've been misdiagnosed. And we, in retrospect, just were so impressed that we went down that road quite quickly. So we had the hearing test, an audiology exam, and found that there was some hearing loss. And it explained a little bit about his a little bit of trouble in school, or some sort of attention-looking issues at the time. So we acknowledged that and figured that out. And probably a year later, we got him into hearing aids. And then we followed suit with his brother and sister and found that both Leighton had hearing loss as well. He was quite a bit younger then, but right away we got him checked. And then subsequent to that, we got them on ACE right away, an ACE inhibitor. And I know we're kind of tight for time. So that's how we diagnosed Lucas. And then we did ultimately have a biopsy just to be very sure. And then and then I've always had hematuria, and our daughter had hematuria. So it's super quite typical of the sex-linked version, where the boys have a little bit more severe symptoms and Livy and I do not.
It is really wonderful that you had an astute emergency medical professional.
Yeah.
That made a huge difference.
Mhm.
And so when you were diagnosed, then at that point, were the words Alport syndrome used? Is that?
You know, shortly, yes, actually, like not from the emergency and then not from the nephrologist, but right away, like in the initial visit, but very, very soon after. Yes, she knew of it. And this is, like I say, 2007. So we
That's
were,
fantastic. Very,
yeah,
very
I mean, yeah. The doctor herself has kidney disease in her history in her family. So I think just had that extra level of personal interest and understanding. So that could have played a role. She's been
Right.
just amazing. Susan Samuel, Dr. Susan Samuel.
always good to give shout outs to great doctors. So that's excellent.
Yeah.
Yeah, hearing loss can often be the key in Alport syndrome. Often unlocks that diagnosis for many patients. If a genetic test is not done right away, or a kidney biopsy, or anything else, just sort of kidney disease in general diagnosed, often it's that hearing loss piece in Alport syndrome that can be a real key to unlocking diagnosis. As a caregiver, because you have 3 children with Alport syndrome,
Right.
what do you see as the challenges of raising children with a rare genetic kidney disease like Alport syndrome from that parent perspective?
Well, as we've mentioned, and it probably comes with a little bit of guilt, but you know, you go through all these different emotions. But our experience on the whole has been, the children have been quite well. So we're very thankful for that. But it does not come without challenges. Hearing, I really want to emphasize the importance of hearing aids are not the great equalizer. So when your child has hearing deficits, so that was just probably the main focus for us to get to have a good school experience, have a good audiologist, have a good, because that was the main symptom that was problematic for our children. Having them on the medication as soon as possible and reaching out to the likes of ASF, connecting with doctors from there. And that has just gone full, it's just you're at maximum velocity. I'm sure there's more to come, but we can reach out to you and figure out what we need to do right away for our kids. I remember waiting a little bit for Leighton just out of fear. I don't know of what, but we didn't put him on an ACE quite as quickly as Lucas. So getting them on medication, keeping the diet at, I won't get into specifics because we just basically tried to eat really quite well. And in fact, we were encouraged to just keep doing what we were doing because our boys were thriving quite well. Now that just, I know it varies, but low sodium and just being aware. But in terms of the hearing and just being an advocate, do not underestimate the difficulty children can have with hearing loss. The hearing aids are not the great equalizer. An FM system is difficult to use. I mean, there's fantastic improvements in the technology, but my boys, they will attest, and Lucas can speak to it if he wants to, that using the FM is even very difficult. So it's just encourage, be super aware. Don't let the teachers tell you they're doing just great if they're at the back of the room, because they're probably not. So just that piece in terms of education was that was my biggest concern, our biggest concern, I think.
I think as a parent myself, raising a son with Alport syndrome, you've raised some really important points there. And not to underestimate also that I hear this a lot. We had a meeting last night with lots of Alport patients that joined us at Alport Syndrome Foundation through our regular Direct Connect monthly meeting, and just a piece about parents feeling that guilt about passing along a rare disease as a genetic disease is just so real in rare kidney disease, including Alport syndrome. And so finding community and talking about that can be really helpful.
That was a huge one. I didn't want to not acknowledge that, because I gently said the guilt piece, but it's very prevalent, and but you fill it with other things. We never let it define us. We were super busy. It just was great. But having ASF, having the the Facebook group, having those opportunities to go to the ASN is what we always did. And just was able to connect with doctors there, and just feeling like you're doing. And then the other piece was that we did quite a few fundraisers and stuff. And so that gave us a sense, especially my husband, I think, a sense that we were sort of doing something, because that's the reality. You want to feel like you can do something for your children. Again, ours were so unwell, so we wanted to feel like we could do something to help others and ultimately help our own family.
I appreciate you saying that, because I think this is really true in Alport Syndrome. I find it myself that actually what seems to help the guilt for a lot of us as parents that we naturally feel because we have passed down this disease unknowingly, and almost always it's unknowingly,
Right.
is taking action, right?
Mhm.
And doing what you're doing, getting educated, and helping find the best doctors for our children, making sure we're staying on treatment, getting our children evaluated, and getting involved and getting building that sense of community can be incredibly helpful for the whole family,
100%.
including that mom piece or that parent piece. So I'm actually going to move the conversation over to your son now. I so appreciate you joining us as a family, because this is a genetic disease, so it impacts across generations, often in a family. So Lucas, in the bio that we discussed about your mom, we didn't really say much about you. Do you want to just tell us a bit about like your age and what your lifestyle is like now and where you live?
Yeah, sure. Yeah, so my name's Lucas, and I'm 22. I go to university. I'm in my 4th year as a business student. I play men's basketball at Ambrose University as well. So I have a pretty active life, and I'd say pretty normal life for the most part. Not a whole lot different than a lot of my friends who don't have Alport syndrome. So that's kind of cool. But yeah, that's the life I'm living right now.
We love to hear that. You have a very healthy and active lifestyle. And I think that's helpful for a lot of young Alport patients like yourself to understand that Alport syndrome doesn't have to define you. Having a rare genetic kidney disease like Alport syndrome, yes, it's going to affect your life, but you seem to be living your best life and not letting it define you, and that's fantastic. And part of this is, it seems like an early diagnosis helped you get on medications early, which is helpful, that are designed to, as your mom said, an ACE inhibitor, which is a blood pressure medication too, which research has shown can slow down the progression of your disease. So in your daily kind of routine at all, are you reminded that you're living with Alport syndrome?
I'd say it's kind of like 2 points in the day that I'm reminded of it, and that's when I wake up and I take my medication in the morning, and then in the evening when I take my medication as well. So whenever I'm actually faced with doing something to help treat Alports, I'm reminded of it. And then I guess another little piece would be maybe when I'm eating food. And as a teenager in high school, I know I like to eat a lot of junk food here and there. I'd go on my stints, but when you're eating a lot of it, you're kind of aware of maybe this isn't the best thing for me. So that was a little reminder just to kind of keep your nutrition being conscious of your nutrition and just trying to make sure you eat the right things to help yourself out a little bit. So yeah, those are kind of the main times that I'm reminded of it.
That's fantastic that you say that about being mindful about your nutrition, because that is really important in kidney disease in general. But with these ACE and ARB medications that we take as Alport patients, they can also exacerbate, for example, high potassium, which can be really unhealthy, right? So, getting educated and eating the right foods and staying away from the wrong stuff can be really helpful. So it's great that you are really aware of that. And hats off to you for trying to do your best as a young adult doing that. That's fantastic.
Thanks.
So have you experienced any side effects from the medications that you take? I assume you're on an ACE inhibitor. Do you have any side effects from that at all, or?
I've been very fortunate to not really been faced with a lot of side effects. I'd say the extent of my side effects is maybe a little bit dizziness or lightheadedness when I'm maybe upping a dose or changing a medication around or something like that. But again, I just know I'm very fortunate to not have had to face a lot of different side effects. I know that's something that people struggle with, and there's a lot worse side effects than being dizzy. So thanks to the help of my parents and being diligent about that stuff, I've been able to not really face a whole lot of that, which is good.
That is great. Because as you're aware, I think, when we met, yeah, I think you met some other Alport patients, young Alport patients, who struggle with that. My own son just fainted all the time. He couldn't even take 2.5 milligrams of lisinopril and ACE without passing out. So he had no protection. There was no drug he could take. So it's really great when young people are able to take the medications without major side effects, and to be compliant with them, because of the research that shows it can be so helpful in slowing down progression. So it's wonderful that you're not having side effects and that it's helping keep you healthy. We love to hear that. So do you think living with Alport syndrome has really shaped you in any way in terms of your education or socially, or the way you see your future?
I think educationally, it's probably been the most impactful, just because, like my mom was mentioning, the hearing is not having hearing aids doesn't make it the same as other people who don't have hearing aids. So I think that's been kind of the main factor for me, and I've had to use some accommodations at school and stuff like that. So yeah, just being aware that you need to put in a little bit of extra work when you have those hearing issues, just to be able to stay on top of your work. And then socially, I guess that kind of ties in a little bit as well. It's never impacted me, or I've never, I guess, I don't know if this is the same for people with Alports or having hearing aids, and like I've never been bullied or anything for anything like that. So that's something I'm lucky about. I'd say the extent of it affecting my social life is my friends maybe poking a little fun here and there when I can't hear what's going on, or I ask them to repeat something more than a couple times. But other than that, it's not really impacted me a whole lot. It's actually kind of part of my identity. Like people know that I can't hear that great, or know that that's part of my life. So it actually kind of, I don't know, plays into who I am. People just kind of accept that. Yeah, no, it hasn't been too impactful in that aspect of things.
I think it's great. Here, a young adult who is really compliant with their medication and really educated about, mindful about renal diet, accepting of your hearing aids that are wonderful tools. My son now treats them as, sort of an extension of his body and feels the way you do, just part of his identity, part of who he is. And likes it that his friends kind of tease him about it. It's just kind of part of who he is. So I really appreciate you sort of sharing your healthy perspective as an educated young patient who's really compliant about it and proactive about their health. And that's really important. So I really appreciate that. I'm gonna maybe come back to you at the end. We're gonna move over to talking to a fellow Alport patient, but there might be questions that come in at the end for Liz and Lucas, and we might come back with more questions. I'm gonna move over and introduce Thierry Cles, who he's allowing us as a French name, and he's allowing me as an English speaker to say Terry. Terry Cles is in his late 40s, married to his wonderful wife, Bruna, who I've met. She is really wonderful. For 20 years with two teenage boys, Julian and Gabriel. He's a computer programmer and consultant at his own company, Full Scope Ahead, Cloud Consulting. His mom, one of his sisters, and he all have tested positive with a genetic test for Alport syndrome. He was diagnosed about 4 years ago, and since then has been active in Alport syndrome patient in our community through our Alport Syndrome Foundation Facebook group, which is closed just for patients and families. It's a private group, support group. He also attended the foundation's in-person conference in San Diego last October, where he got to meet fellow patients and attend presentations by doctors and researchers. He's the first in his immediate family and extended family to get accurately diagnosed with Alport syndrome. And he's followed by his very knowledgeable nephrologist, whose name I do not want to not say correctly, who works in the north of Montreal. I'm going to let Terry do the honors with the name when we speak later. He takes a number of medications daily to help with the disease and is participating. He's also going to participate in a screening in March next month in Boston to see if he can take part in a clinical study for new medication targeted for Alport syndrome. In his free time, he loves skiing and attending concerts and bird watching and spending time with his family. So welcome, Terry. Thanks so much for joining us.
Thank you. Thank you. I'd also like to thank you for all the work you do for the foundation and the help to other Alport patients.
I appreciate that very much. It's really my honor. The work is so personally meaningful, as you know. So medical professionals, Terry, often think of Alport syndrome as only seriously affecting males, but your sister actually experienced renal failure due to Alport syndrome, which is actually not uncommon in some genetic types and genetic variants of our rare disease. And it seems your medical professionals missed several opportunities with you to accurately diagnose you growing up. So can you tell us a little bit about your diagnosis story and what led to you finally gaining an accurate diagnosis of Alport syndrome?
Sure, sure. So the diagnosis almost, before I got a diagnosis probably took almost 4 decades. So the first signs, first symptoms, I was 10 years old. I lost appetite, I was weak, so we went to see the doctor, did some labs. Turns out I had microscopic hematuria, so blood in the urine. So starting at 10, I was seeing a nephrologist at St. Justin Hospital here in Montreal. My mother told me she also had microscopic hematuria, but that it didn't affect her, not to worry. So, I didn't really feel anything, besides when I was 10 years old. And then being, young adults, I didn't really follow through on appointments for monitoring my kidneys. But I did have a nephrologist who happened to be a friend of the family. And eventually, an insurance broker, proposed, I forget what kind of insurance, but the insurance company didn't want to follow through unless they knew the root cause of the microscopic hematuria. My nephrologist said the only way to know that would be to do a biopsy, and he thought it wasn't warranted, that there were risks involved. So right there, that was a missed opportunity, because I think if I would have done the biopsy, maybe something would have shown, and maybe I could have taken medications at that point, which was my mid-30s. After that, maybe another 4 or 5 years, I started having high blood pressure. My family doctor at the time had me see an internist, and essentially he told me I had to monitor my blood pressure and that my destiny was in my own hands. That's basically the advice I got. So right there, that was a missed opportunity as well. Fast forward another probably 6-7 years, and unfortunately, my sister, from one day to the next, she had kidney failure. From one day to the next, she had kidney failure. She had to do dialysis 3 times a week, and since then she can no longer work. So that was a surprise for us, but for the whole family. And at the same time, I changed family doctors with Dr. Mélanie Lavigne, who's very hyperactive in her thoroughness, and had me do a battery of tests and see a new nephrologist, which is Dr. Simon Meyer at the Saint-Jérôme Hospital north of Montreal. And I think, because of what happened to my sister, she had me do a biopsy. And the biopsy showed that I had FSGS. and she said I was already taking the right medication, which was candesartan, which is an ARB. So, you know, from that aspect, that was good. But since I had kids, she wanted to find the root cause, because she thought she already thought it could be Alport's or maladie du berger, which I'm not sure how you say in English, but she already had an idea of what it could be. So she had me do a genetic kidney panel, so for multiple diseases. And it came out that I was positive for Alport's. And then I saw a genetic counselor, and she explained to me that it was the gene COL4A3, and that it was autosomal dominant form. And that meant that my kids had a 50% chance of having the disease as well. So we had them tested, my two sisters and my mother. Fortunately, my kids don't have it. And obviously my sister who was sick, she had it as well. And my mother had it. Although for some reason it hasn't affected my mother that much. She's in her mid-80s now, so.
It is so interesting, Terry, the range of experiences of Alport patients. And you've really hit on some important things here. Misdiagnosis is so common. We share that same experience. That I was denied a biopsy. My son was denied a biopsy. I asked for one, and they wouldn't do a biopsy. So we missed out on, 8 years of potential treatment for him because we weren't able to have one. We were told we couldn't. And so you had the same issue. Genetic testing is so important. I'm so glad that your family finally has unraveled this mystery so that everyone could get tested, so that you could know for your children that they don't have it, don't need to be on medications. This is really important. So I'm so glad you're being so proactive. We appreciate all the work that you do as a volunteer, helping other patients now, giving back to your own community, helping others get diagnosed and go through that. Really, really important. So I appreciate that.
Thank you.
I'm going to ask you in a few moments here, some questions are coming in, but I'm going to quickly ask you about medications because some of the questions that have come in are
Sure.
about medication.
Sure.
One person was asking the medication that Lucas is on, which, Lucas, can you quickly tell us what medication you were prescribed?
Yeah, the medications I take right now would be losartan and aflosan, and I don't actually know how to say the full name of it. I could bring it
Would
up
you like
for
me to
you,
say
but
the names? Do you want
Sure.
the full
Sorry?
names?
Sure.
No,
yeah, you probably know
so
better than
it's
me.
well, it's okay. It's an ARB, so that's the losartan, and he takes 50 milligrams a day, and the dapagliflozin, which is understandable. You can't say it, Lucas. And it's the generic name is Forxiga, which is a diabetic drug.
Yes, that class of drug, SGLT2i,
Yes, yeah, the
has now in
SGLT,
2021 was approved for all kidney disease, and now it is
in adults.
yes, in
In
adults. And adults only. In the UK, I
Mhm.
believe you can take it beginning at age 16, but in the US and Canada at age 18. So these are new medications, new tools in the tool basket that is being sort of tried in Alport patients and other glomerular diseases, which is very helpful. Thierry, you are also on some medications. Can you tell us a little bit about what medication you take and if you have any
Sure.
side effects from them?
Sure. So I take, as I mentioned, I take candesartan. I take the maximum dose of 32 milligrams. I also take Forxiga. I think in the States they call it Forxiga. There's a different name. I take the maximum dose of 10 milligrams a day. I also take allopurinol 200 milligrams, which is to prevent gout, which people with kidney disease can encounter. And I also take vitamin D weekly. And in terms of side effects, at one point I was taking both the candesartan and the Forxiga at the same time in the morning, and I was feeling dizzy, like getting up and feeling dizzy. And my doctor suggested that I take one in the morning and the other one in the evening, and that works for me.
Which is great. We're also very different. I mean, we are talking about medications here. So we always want to encourage, personally, I'm not a medical professional, and neither are the patients, right? We encourage you to always talk to your trusted medical professionals about what the right medications are for you. Note that Alport syndrome is a rare disease, but it's also called an orphan disease because it doesn't have any FDA-approved therapies at this point. Nephrologists are using standard of care, which is, we've been saying that word ACE inhibitor, which is a blood pressure medication. And that is standard of care from nephrologists in Alport syndrome, using this drug to slow progression. But always best to speak with your doctor, of course, your trusted medical provider. Thierry, you mentioned that you were getting screened next month for a clinical trial. Can I ask you what motivated you to consider a clinical trial participation?
Absolutely. I mean, there's two reasons. One noble and one selfish. The noble reason is that just to advance science and hopefully help in finding a medication for all Alport patients. Actually, during the Direct Connect for Alport patients in San Diego, one person did a presentation that really drove the point of how important that is. So there's that. And the other reason, selfish reason, actually one of the patients I met there, she mentioned to me that she's on a clinical trial and she's getting a great benefit from that drug, not the same one that I'll be attempting to take. She mentioned that her protein was being reduced by 50% in her urine. So that seemed very tremendous. So I'm hoping if I meet their criteria, if the screening goes well and I participate in the clinical study, I'm hoping that it's going to benefit me as well in the same manner.
Yeah, I think that's it's important. I like that Dr. Brew's presentation talked about that it is excellent now that there's finally a pipeline in rare kidney diseases, including Alport syndrome. So it is an opportunity, and getting accurately diagnosed with the right kidney disease leads us to so many important opportunities to get the best care, best treatment directly with our medical providers, guidance, but also to potentially participate in research, such as patient registries and natural history studies that drive important research to better understand the disease, and opportunities to participate in clinical trials. So that really is important. I want to take another question here that someone was asking about in terms of, I think this is a question for you, Liz. How do you deal with this sort of emotionally, of taking care of yourself and your child, knowing you are a patient, and also all of the appointments and the emotion around your child?
Yeah. With the appointment, I will comment on appointments. There are many. But again, it's sort of doing something, and of course you connect with the right people and you're getting it managed as best you can. So that's, I guess, a good feeling. But the I do have the good fortune of I had more time than maybe some. As I think my bio said, I taught for quite some time, and then I had a small business, but it was very flexible. So I could take the kids, the appointments, and then we tried to make them, again, we weren't super, we weren't super forthcoming with a lot of information with the kids early. We chose that route and kept it a little, so we would take them to, they knew why, they knew the name, but didn't totally understand it. And kids generally wouldn't. So we tried to make it a little bit fun. I remember we would often do something after an appointment, but that's the light stuff. Yeah, emotionally, it's just, it's there, it's always there, but again, you just keep going. And I really appreciate that some people have had it harder. So I don't want to minimize our experience, because it's very real, especially for my kids who actually suffer from different parts of it. But myself and my daughter are currently not, we're doing well. And so I am almost a little shy to give a bunch of advice, because the appointments are a lot. You want to keep them sort of tight together and be really stringent on the timing. And that helps if you just sort of do it at, a specific time of the year, like every June, June and December, you sort of do your 6-month things and keep them together. And we've also added optometry appointments. And I wanted to comment too, in terms of diagnosis. Unfortunately, there's a third element to it, and it's looking more and more like, you can diagnose quite accurately through the eyes or eye abnormalities. So that's something we're learning a little bit more about. So
Yeah,
it's on
there. Thank you for raising that. That is important. In Alport syndrome as well, the eyes can be affected, and there are all sorts of eye conditions. You can read about that on Alport Syndrome Foundation's website. But I think one thing here, interesting to that question, I think I'll say that one person had called me after my son had his transplant, and we went through dialysis and transplant, and my older son giving the gift of life through organ donation. So another patient called me and said, I have a young son, and I'd like to know, like, what is it? How did you get through that? And I said, it's almost like packing your bag when we were pregnant, and we knew that it was going to happen at any time. We knew we were going to have the baby. We didn't know when. So we packed our bag and put it in all of everything we needed, and we put it by the door. And I feel like that's what I encourage other Alport patients to do, is if they pack your bag, get educated, have all the education and the information and preparation in your back pocket, because transplant may happen. And when that time comes and stage renal failure may come, you want to be prepared, because it is an emotional time. So preparing in advance and talking to other patients and getting educated really helps you prepare. And that's what I would say. It was really helpful to us that we had packed our bag with education and relationships with other patients and great doctors that could guide us. I think we're running out of time. Actually, we have so many good questions. If you would like to ask questions of Alport Syndrome Foundation, you can contact us at info at alportsyndrome.org, or of course the Kidney Foundation of Canada. I'm going to turn things over to Carrie Thibodeau, who can help us close this out. And I really want to say thank you so much to everybody, to Dr. Barua, to Thierry, Lucas, and Liz, and to my fellow wonderful patient advocates at Kidney Foundation of Canada.
Thank you, Lisa. We'd also like to thank Dr. Barua for sharing her knowledge and expertise about rare kidney disease research, and to Liz, Lucas, and Thierry for a really, truly moving and engaging discussion about Alport syndrome. I know that your experiences speak to so many people in the rare disease community, so we know that there'll be a lot of appreciation for that. The Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system and support in the community. So we do invite you to contact us if you have further questions. When today's webinar ends, your computer will open a new page requesting that you complete a satisfaction survey. Your feedback is very important to help us continue to improve our webinar series, and so we would appreciate it if you would take just a moment to complete it. The survey is available in both English and French through a language button in the upper right-hand corner of your screen. On behalf of the Kidney Foundation of Canada, thank you for attending today's webinar, Rare Kidney Diseases, Challenges, Opportunities, and Alport Patient and Family Perspectives. Have a wonderful day.